Next to a remarkable individual like Dr. Fisher, who worked in Guinea. He's now working alongside many others like him, Dr. Stephen Hatch. He's an infectious disease specialist volunteering at a clinic in Swakoko, Liberia, run by the American charity International Medical Corps. Now, before going, he wrote about why he chose perhaps the toughest job in the world today. He said, quote, "Why do firefighters run headlong to the fire? To put it out, of course. Ebola is not really different, and it is my fire, along with many other colleagues. I go to put it out." Dr. Hatch joins us tonight from the clinic in Swakoko. What is it like to treat patients, to deal with people wearing that full protective gear? I mean, not only physically for you, but also just emotionally. I mean, so much of what a doctor does is physical contact with somebody, looking them in the eye, to have that limitation of this essentially like a spacesuit. What is that like?
It's challenging. Patients cannot see our faces, and especially on their first 24 hours in the wards, that's a terrifying moment for them. Once they actually step outside, and we have lawn chairs for them to sit out in the units, we walk to the areas where we can see them and they can see us, so that once we go inside and we're anonymous behind those things, they hear our voices and they know what we look like when we're not in protective gear. And ironically, one of the things that we do is we do touch our patients in the unit, and it's the only place in Liberia where there's no prescription against that. You can touch your patients when you're in protective gear, and yet when we're outside and I'm among my colleagues, I don't touch anyone.
Have you ever worked on a virus like this, I mean, that has such a high mortality rate?
I haven't worked on a viral infection like this that has the potential to spread to anybody and with a high mortality rate. No, I've never seen anything like this.
I mean, if you don't mind, just a personal question, how do you deal with the level of fatalities that you're seeing, the death that you are surrounded by?
One of the things that's been very gratifying about working in our treatment unit thus far is that we see survivors. And we do see a stream of death. What we haven't seen thus far is a tsunami of death. And so when we see people die, it's balanced by the fact that we're seeing a lot of people on our positive side who we know have the virus, and they're living through it, and they're living through some of the worst of it.
You earlier described this as a war. That's how you see this?
Metaphors are always dangerous, but this does seem an apt metaphor in this case.
And do you feel like you're winning?
Today was a tough day. You're asking me on a day when we actually admitted a lot of people who were relatives of our current patients. So it was a bit of a deep breathing exercise for us. I cannot say which way things are going right now and whether we're winning the battle or not, but I think that this is something that we must do, not only for the people of Liberia, but for all people around the world, because this problem has the potential to spread and metastasize to every country on earth.
Dr. Stephen Hatch, I really admire what you're doing. Thank you for talking to us.
Thanks, Anderson. I appreciate it.